Hey, this is Dr. Kaan of the ACL Academy. We're back with another video, and today we're going to touch on a popliteal cyst, otherwise known as a Baker's cyst, which is fairly common for people after sustaining a knee injury, in particular an ACL injury or meniscus injury. Before I get further into the details, as you follow along with our page, please like, subscribe to our channel. If you have questions, comments, drop them below. And more importantly, share with a fellow ACLer that can benefit from these tips and education that we put out here weekly. So, Baker's cyst, what is it? A Baker's cyst is a fluid sac, fluid formation that is located in the back side of the knee. We don't necessarily know the exact reason why this occurs, but it is very common with people with knee injuries, particularly ACL and meniscal injuries. And what happens is after an acute injury, right? After an injury happens, specifically an injury inside the joint or the joint capsule, which is basically a bubble that surrounds the knee joint itself, there's going to be fluid formation, right? We're going to get swelling, and that is a first stage of the healing process. So as we get injury, the body responds with sending more fluid, more nutrients to try to recover, to repair. And what happens is that fluid fills up. Now, if that fluid doesn't resolve fairly quickly, for some people, if it does linger for a time period, what happens with a Baker's cyst formation is that fluid will start to pool in the back side of the knee joint and form basically ball or cyst-like structure, and that is known as a Baker's cyst. So it's the fluid that develops after an injury, doesn't go away, it starts to pool in the back side of the joint, and it forms a cyst, and then it hangs out there. Most cases, this will resolve. Unfortunately, once this happens once, this can happen again and again. So if you are one of those people who has a cyst formation, a Baker's cyst after an injury like this or during the recovery rehab process, it may kind of sneak its head back up from time to time. You piss off your knee and the knee swells and it's not taken care of or doesn't reduce, it will start to kind of pull in the back and it will form that cyst. Some cases it could form and not be symptomatic at all. You may not even know it's there. In some cases, though, it can be minimally painful to moderately painful. And when it is painful, it will be most annoying at end ranges. So max amount of extension or straightening and max amount of flexion, especially weight-bearing closed chain flexion. So for those of you earlier on the process, you're in the middle of the process, you're still working on range of motion, you haven't felt like you got your extension back or your flexion end ranges there. If you do get a cyst formation or if you get pain, or you don't know if you have a cyst and you get pain in the back side and you're like, wow, it just really like hurts when I really try to straighten my knee and I stretch it out, or if I try to do a deep squat or I try to kneel and it's like, wow, I'm getting some pinching and just aggravating like type sharp pain in the back side there, you may want to check. And what you can do is basically in the armpit of the knee is you'd put your hand in that area and you may feel like a little bit of a bump that you can kind of push into. It may have a little bit of a rebound effect, maybe even be tender to touch, especially if it's a Baker's cyst that is annoying and painful and symptomatic. So in those cases, if you do get a Baker's cyst, you're getting pain at end ranges, what can we do? As I said, the body should resolve, it should help it get absorbed and get it flushed out. But at times it can linger and stay. So what can we do on our end? Well, we want to avoid irritating it, right? The more we irritate it, the more we kind of press against it, the more it's going to kind of stick around because it's going to piss off the knee more and more fluid's going to form. The way that I explain it is like if you piss off the area of the knee, it's almost like getting sand in your eye, right? It's an aggravating response. And what happens is the body starts to produce fluid until we can get whatever that annoyingness is out of there. So we want to try our best not to poke at it, not to push on it and prod on it. So what we do is we want to avoid end ranges, right? So even if you don't have or own your full range of motion, you're bending your extension, well, we still don't want to go to those end ranges and bother it. So we want to go right up to that point, keep pain levels below 1 or 2 at max. You can still do your mobility work, you just may not do it as aggressive as you would before. Other things that we can do is some compression, right? So keeping a neoprene sleeve on the knee itself will bring warmth, bring compression, will help bring new blood flow, help wash out all blood flow. Lastly, we can back off maybe some of our weight-bearing deep flexion exercises. So any type of deep squats, any type of deep knee lunges, These are things that, it's going to bring us to those deep ranges, and it's going to be weighted, so we're going to end up pissing it off more. So those are things that I would back out for. So it's just a matter of activity modification, so less weight bearing exercise, less aggressive deep weight bearing exercises, and you can use pain as your guide there, as long as you're keeping below, let's say, pain below 2 or 3 max compression. So I would keep compression on all day long, and a knee sleeve is fine. You could wear a full leg sleeve, but a knee sleeve should be fine, and you should wear this throughout the day. As well as you can use heat or ice even as a little bit of an analgesic in the backside of that area as well. But just know the body would absorb it. And lastly, just avoid the deep mobility work, right? So end ranges of extension and ranges of flexion. The more you're in that, you're going to put more taxing on the backside area there, whether you're stretching it maximally in extension or when you're closing it down with flexion, right? So if I close down the joint, I could be pinching that cyst, that ball of tissue. Having said all that, usually it's not a big deal. It can be annoying, won't necessarily slow down your progress, but if you don't take care of it, you continue to piss it off, it'll linger. And if it lingers, it's going to kind of just, annoy you with the mobility work, annoy you with the strength work. And these are things that may, in long term, slow it down. So we take care of it early. We back off some exercises. We back off some mobility work. Keep the compression on. The body will absorb it little by little. Now, with these, as far as medical treatment goes, usually not much is done. As I said, with activity modification and the body doing its thing, should take care of itself. If it's something that really gets pissed off and lingers, there are ways that your surgeon may look into an oral medication, oral steroid, or worst case scenario, they would aspirate it, but they really try not to do that because it's an area where you do have some nerves, arteries running through there. They like to avoid that, not to cause other issues there. Very common, happens even with people without injuries. 4 to 8% of the population. It's even more common with a knee injury, as I said, particularly ACL injury, meniscus injury, any injury inside the joint itself, bubble that we talked about. And if it does happen to you once, you're at a higher risk factor or category for happening over and over again. So we just have to monitor it, be wary of it. If you do have it, if it's not painful, you don't have to worry about it at all. You can work through it. As soon as it becomes symptomatic, that's when we would go over those steps of modification, whether it's exercise modification, range of motion modification, keeping compression on it, staying away from deep stretches, staying away from deep weighted positions such as kneeling and lunging. Those are the things, that's how we would take care of it. In most cases, as I said, it'll go away on its own. You'll be able to resume at full activity or a full participant in your recovery process. Guys, if you have questions about any of this, drop them below, or any comments as well. If you found value, please like the video and please subscribe to our channel. And more importantly, share with a fellow ACLer that can benefit. Tips and education. This is Dr. Kaan signing off. We drop a new video every Monday here on our YouTube channel.